We're going to have a wonderful show tonight, and I hope you'll all be there. But very quickly, I want to introduce two very interesting commitments, and then I will close up and tell you what you did here. You need to know, and then we'll finish. First, I'd like to ask Brad Wilson and Kathy Higgins of Blue Cross Blue Shield of North Carolina to come here. They are dealing with something I spend a lot of my life and foundation time and resources on: childhood obesity, a national health crisis in America and increasingly in other countries. 1 in every 3 children between 2 and 19 is overweight or obese. And while a majority of these initiatives target children of school age, recent research suggests that even waiting until after 2 may be too late to effectively reduce the risk of obesity. And I'll give you a related, several years ago, there was a study of the obesity rates of various groups of Americans. And at the time, the highest rates were among Pacific Islanders. And the medical research over 20 years showed that that was because 3 generations earlier, they had the highest caloric burn rate. And that literally the grandchildren of people who stood in the Pacific Ocean and fished with nets standing against the tides and burned thousands of calories a day, their bodies were telling them they still needed the same caloric intake. So this is really, really important. This commitment by Blue Cross Blue Shield of North Carolina to launch SHAPE NC is an early childhood prevention initiative that will work with 30 communities over 3 years to develop and implement anti-obesity plans focused on physical activity and healthy eating. A child care center will be selected to be a training hub. 100 early childhood professionals will be taught effective tactics for combating obesity in children under 5. And the foundation will work in collaboration with the North Carolina Partnership for Children, as well as the Institute for Medicine, to provide policy and program recommendations on this problem. Thank you. You may be saving a lot of lives. Thank you.